Hello, my name is Zhanna and I'm an FNP student at Maryville, and today I'll be performing my neurological exam on Cindy. Cindy, could you please, so you want to ask the patient to state their full name?
Cindy Bertolino.
And date of birth?
4/23/75.
Okay, Cindy, do you know where we are today?
Yes, Barnes Jewish Hospital.
And do you know what date it is?
Yes, November 9th, 2016.
Okay, so this test, that the patient's alert, oriented to the situation, and knows where they are. I will then begin with testing the cranial nerves. Cranial nerve number 1 is olfactory nerve, and we test for a sense of smell. If you want to have the patient, please close one of your nostrils and go ahead and smell. What do you smell?
Peppermint.
Okay, and the other one, same thing. This is not typical. There you go. And this is typically not done in an office setting, but if you do this, you want to have a kind of like a strong smell so the patient can identify it. And it's just testing for a sense of smell. The second cranial nerve is the optic nerve. We will use our pen light to check for the red reflex in the patient's pupils. So just shine the light directly. We will also use the ophthalmoscope to look deeper into the eye to check the optic nerve and the optic disc for roundness and to check that everything's intact there. We will then look for the third one, which is the oculomotor, and here we look for pupil constriction by looking directly, and the pupil should constrict once we shine the light, and then consensual, which the pupil should constrict and come together here. The fourth and sixth cranial nerve is we're testing the trochlear and abducens cranial nerves, and this is by testing the 6 cardinal movements. You ask the patient to please look only at my finger, don't move your head. Okay, and the eye should follow the movement in the 6 cardinal directions. Okay. The next one is the number 5, which is trigeminal, and it basically just tests for the motor function of the jaw. You listen for any cracks or anything, so go ahead and clench your jaw. Okay, good, and move your jaw side to side. So basically testing for like Team J and things like that as well. We will then, another test for trigeminal is to take a Q-tip, and you just have the patient feel on the face of the sensation. Is it sharp or soft?
Sharp.
Okay.
Sharp.
Oh, whoops. Okay. Don't use one that fell on the floor, but so basically just test the sensation on the face. The next one is 7, which is a facial. We ask the patient to smile, and without showing teeth, puff your cheeks. Good, and wrinkle your forehead. Good, and go ahead and frown. Good. Okay, the next one is number 8, which is the acoustic. We stand on the side of the patient or behind them, have the patient close one of their ears, and we say a word, apple.
Apple.
Okay, and on the other side, whisper another word,
Apple.
okay, and make sure the patient can hear that. Our next cranial nerve is number 9, and that is the pharyngeal nerve, and basically we test for swallowing. A lot of patients, especially with like stroke patients, have something called dysphagia where they can't swallow, so we assess for that. Go ahead. Okay, and then we check on the inside, ask the patient to open up their mouth, and we check the hard palate, the soft palate, and go ahead and say ah, and we check the uvula for movement and symmetry. This also tests the vagus nerve as well. The next one we move on to is a spinal, so we check for spinal accessory cranial nerve, and you want to go ahead and have the patient shrug their shoulders, good, and move the side, like their face side to side against my resistance of my hand. Good. Great. Okay, the next cranial nerve is the hypoglossal, so have the patient stick out their tongue, make sure it's not drooping, and make sure that they can move it from side to side. And we will go on to check for cerebellar function and coordination and the fine motor skills. Typically, you want the patient to stand up for this. Go ahead and stand up, Cindy. And I want you to try and see, I want you to just walk to the door, and I want to evaluate your stride, your posture, the movement of your arms, your gait. Make sure there's not like a shuffling gait or anything, which can be common with Parkinson's patients, arm movements. Go ahead and do a heel to toe walk. Good, and then and walk on your heels. Good, and walk on your toes. Okay, and can you do a shallow knee bend? Very good. Okay, I will then assess, go ahead and sit back down, Cindy. I'm gonna assess for your muscle tone and strength in different areas of the body. So typically we would start at the top, and this again tests for muscle strength and again, like there's a patient like can be one-sided on the strength if they have like a stroke or anything. So go ahead and lift your hands up. I want you push up against my resistance and push down. Good, I want you to squeeze my fingers. Okay, and you want to test on each side. You want to also go ahead and move on to the elbows. So go ahead and push down. Okay, side to side. Good, and then the upper arm as well, which tests the shoulders. So press against me and inside. Good, and you want to repeat that on both sides. Make sure that both are have the same strength. You will then go on to testing the shoulders, again, shrug up against my resistance and down, and you want to check the feet as well, so press down on my palms, okay, and then press up against, okay, and same thing on the knees, press your knees out towards my resistance, going back, good, compare side to side again. We're assessing here flexion, extension, abduction, adductions against different areas of the body for resistance. Our next test is called a Romberg test, and this is basically, we ask the patient to please stand up, close their eyes, extend their arms out with their palms up to the air, and we just want to check for any drifting on one side or the other. Another test you could do for this is called the pronator test, where you basically just put resistance and hit the palms, and the palms and the arms should bounce back to the original position. Okay, go ahead and have a seat. Our next sets of tests for neurofunction is a sensory function test, and this is basically we're doing for superficial touch and pain. We can take a Q-tip and we will just see if the patient's feeling sharp, dull, or soft.
Sharp. Dull.
Okay.
Sharp.
And you can test this on different areas of the body, make sure that they're feeling different pain and touch sensations. The next is called a vibratory response, where we check for the vibration sensation to make sure the patient can feel vibrations. We strike a tuning fork, put it on the patient's sternum. Tell me when you don't feel the vibration. Feel it, okay. And again, we strike and put it at the patient's big great toe.
I feel it.
And then we move on to the ankle.
I feel it.
So you mainly want to do it at like the joints and the bony prominences, and you want to repeat it on the other leg. And we can also test it on the upper extremities, so on the thumb.
I feel it.
And on the wrist here, on the bony part of the wrist. Good. And this tests for vibration response. Perception of position and sense with movement of toes and fingers. So basically, what I want to do is have, I guess, position of sense of movement of toe and finger. So have the patient, so basically what you want to do for this one, it's kind of an easy test. So you move the finger a certain direction, tell me where I'm moving it.
Up. Down.
Okay, and you can repeat that with the toe, also move your toe up, move the toe and have the patient tell you if I'm moving it up, down, and left to right. And it's just basically to test to make sure that they know what the position of where their body's going. Our next one will be to identify familiar objects. This is called stereognosis. You want to place an object in the patient's hand with their eyes closed and let them identify it and tell them what it is. Make sure it's a common object that they can identify easily.
Coin.
Okay, so that's very good. This test for like brainstem dysfunction and things like that. The next thing we want to do is two-point discrimination test. This basically, we take a paper clip or a bobby pin and we test it first. We kind of spread it out and we test it first on the patient's hand. I'm sorry. And you let me know if you're feeling 2 points here. Okay, and then on the leg as well, so like a smaller muscle group and a larger muscle.
2.
Okay, and typically the distance on a larger muscle has to be more, a wider distance for the patient to be able to feel it. The next thing we will do is a test called graphesthesia, and this is when the patient gives you your palm, please close your eyes, and I am going to draw a letter on your hand, and please let me know what that letter is.
F.
Very good. And the patient can identify the letter or the number. The next thing is identify a body area where you touch it, so basically it's for sensation again. So I will touch have the patient close their eyes, I will touch an area of the body, have them open their eyes and tell me where we touched. Good. Okay. The next one is we check for deep tendon reflexes. We start with the brachioradial, so we will use our reflex hammer and go here, very good. Then we do, the next one is the bicep, okay? And then behind is the tricep. Then the patellar, which is a frequent one that people use and think of to strike your hammer there. And then we do the Achilles. Good, over here. The next one would be to have the patient lay down. You want to assess their abdominal muscles and reflexes here. We'll take the other side of the reflex hammer, and when you swipe your reflex hammer over the patient's abdomen, you want to see muscle contraction, which is like a normal response. The next one is a plantar. So what you want to do is also use like an object, and in like young children we call this the Babinski reflex. But what you want to do is you want to move this, and then flexion of the foot is normal for adults. The next one we want to check is if you have a male patient, also when you're doing the abdominal assessment, I would also check for the cremaster muscle, which basically